Hello and welcome to HealthTech Hour on UK Health Radio. My name is Steve Roest, and each week we bring you the best news, views and interviews with the leaders and entrepreneurs who are leading the health tech revolution in the UK and beyond. I'm a CEO and founder of a health tech company myself, and I'm passionate about the people and companies who are changing the world. Before introducing today's guests, and yes, we have two guests on today as a first for the show, please follow us on Twitter and Instagram, which is at HealthTech Hour, and also follow UK Health Radio, which is at UK Health Radio, to stay on top of all of the great shows that are coming up. So, as I said, today is a first. We've got two guests. We're going to see how it goes. I don't know, it could be a bit bumpy, but I'm sure it will be good. Our pre-production call went well, so I'm sure it will go well on the day. So my first guest, Jenny Thomas, is fair to say has spent her entire career dedicated to improving the delivery of health services wherever she goes. Firstly, as head of women's health at a major London hospital, and for the last few years as the director of DigitalHealth.London, which has helped hundreds of startups enter the NHS and improve care in a number of areas. It's helped push the agenda of digital health within the NHS, and it supports NHS staff to deliver improvements inside the system, from within the system. Oh, and yeah, somewhere in all of that, she managed to get a master's and an MBA. So yeah, quite busy period of time. One of Jenny's passions is as an advocate of women's healthcare and femtech, which brings me quite nicely onto my second guest, which is Mridula Pore, who, as CEO and co-founder of Peppy, is helping employees access support for life issues that are not normally covered by workplace healthcare, such as fertility, menopause, and parenthood. Mridula started Peppy to give people greater and more equal access to support. And it is this passion for health equality from both Jenny and Peppy that has been encapsulated in Peppy's campaign, which we're going to talk about, which launched this week, called Black Mums Matter Too, which is aiming to address the huge disparities in health outcomes for Black women pre and postnatal compared to white women. So normally, guys, the show is in three parts. So we do a kind of an origins bit, then we go into how you guys are changing the world, and then we sort of end with the future and what other things might be kind of on the agenda today. So we will try and see how that goes with two, and just, you know, we'll see how it goes. So Jenny, starting with you, how's it going? How's lockdown?
Yeah, it's great. Well, great. It's busy. It's busy, particularly the last few weeks, because I've got two little kids, both nursery age kids, and they were at home post-Christmas. They actually went back to nursery yesterday, much to our relief and their joy. So yes, it's a busy time, but like everyone, you know, it's tough, but I think knowing that everyone's in the same boat helps a lot, and I think that kind of solidarity is you know, is key, isn't it? And in terms of digital health, I guess that's been one you know, one of the positives that you've got to find the positives in these tough times, and I definitely think kind of I returned from maternity leave after the first wave in September, and just kind of seeing the step change in digital health in the UK has been a great thing to see. Yeah,
so I think we can get into that, because there's been, I mean, we one of our advisors is a GP within primary care, and his view is that there's been more innovation within primary care in the last, you know, 12 months than there has been in 12 years, give or take. So, but you, Jenny, you actually started, you went into the NHS on leaving university, is that right? You went onto their grad scheme. So you made a pretty early call to that was the path. So what was, did you know at that point, or was it kind of a gamble, or what was the motivation there?
Well, so after university, I had not one but 3 gap years. So I had a lot of time to think about what I wanted to do. And yeah, my degree had a kind of aspect of healthcare to it. So, and my family are quite medical as well. And I was looking at different graduate schemes, and the NHS graduate scheme is fantastic. You really get to learn about all aspects of the health service in your first 2 months, kind of shadowing everyone from porters to surgeons to people in the Department of Health. You know, you're on an ambulance.
So you like on the front lines?
Yeah, you really
it's not just desks. It's not just desks.
No, not at all. Well, the first 2 months you shadow everyone, and then you have a number of different roles in the health service, and you really get a kind of wide-ranging kind of set of experiences. So I thought it looked like a fantastic graduate scheme, and kind of really played to my passion as well. So yes, that's kind of what led me to the NHS in the first place.
Okay. And how did you sort of transition from there to managing women's health at a hospital? And what does that even mean, managing women's health? What does that sort of involve?
Yeah, good question. Good question. Often one it came up every day. I think in many ways it's like managing anything. There's lots. It's very multi-dimensional. It's about ensuring fantastic patient care. It's about supporting all of the different staff who are delivering that care. It's about good governance. It's about the finances of the department. It's about looking for service improvements. It's about all the different standards that you need to meet, whether that's kind of waiting time standards. There's a huge kind of variety of different things that you've got to do as a general manager or as a service manager in the NHS. I think it's a really important job because it's about supporting those who are delivering that care to all of us, to all of our families.
Okay. Do you feel like that role is sort of somewhat underappreciated by the wider world, or misunderstood, so to speak, as because it's not necessarily so visible on the front line, but it's a critical piece of the machine?
Perhaps, but I think it depends who you talk to, and I certainly I've worked with amazing clinicians, amazing clinical directors, for example, that have been my kind of boss in a number of operational management roles. And I think when there's good management support, that's really recognised and really appreciated. But I guess not everyone is familiar with how the NHS works, and it's yes, there's always kind of education there, but certainly I've kind of have been fortunate enough, I guess, to work with people that do actually really recognise the benefit and getting that support, whether that's kind of with business cases or making service improvements. It's about really working together across the whole multidisciplinary team.
I think the role of management now as part of the pandemic, especially with the rollout of vaccines and testing and continuing, I think that has become much more in sharp focus about the value of having those roles in the system, because otherwise it's all well and good if you have frontline staff, but obviously when you're trying to do these things at scale, then it doesn't happen unless you have people actually operating or managing that stuff as well.
I would agree. I think it's about appreciating all of the different roles within the NHS, and when everyone comes together, that's when things work best.
So how did you, what was the transition like from that role into the Digital Health or Digital Health London? And actually maybe you could just, explain a little bit about what that organization does, which will be a nice segue into introducing Mridula. Because Peppy, I know, are on it or have been on it anyway. So, so what was that transition like?
Fun. It was great. I think it's fair to say that digital kind of throughout my NHS career has always been a thread. I've always been involved with different initiatives to improve services through the use of digital. Even in kind of my early career, I was involved in projects to, for example, clinic letters. So after you have an outpatient appointment, clinic letters used to be recorded on tapes, and it'd be quite difficult to find kind of priority letters or to kind of share out the workload across different teams. So I led a project to digitize that, such that lots of different members of staff could support with typing letters, and priority letters could be done when they needed to be. So there's lots of different things I've been involved in, but it was probably when I studied at London Business School, did my MBA there, that I really got exposed to different industries and actually the benefits that digital had brought, and met a number of different startups in the digital health space, and really saw how much that different kind of way of tackling problems that perhaps have been there for quite some time can be achieved. And I got to work with a number of startups in one of my roles within the NHS and really saw the benefits. I also experienced quite a lot of the challenges of how you do work with a startup when you're within the NHS. And so kind of learned myself how to overcome those challenges. And then I was, thinking, what do I want to do? Do I want to kind of work with a startup? Do I want to maybe set one up myself? And then came across this opportunity to set up the DigitalHealth.London Accelerator. And it just seemed like a fantastic way to support the NHS and to support amazing businesses out there, not just one, but lots.
Hundreds now, is it? Hundreds?
Yeah, hundreds. I mean, hundreds.
That's amazing.
At least through the accelerator. And then we have another earlier stage program called the Launchpad. There's a number of businesses. So yeah, it's a lot.
That is a lot. So what was I going to say? With the Digital Health London piece, what are the kind of values that underpin that you think are the sort of the themes of what you're trying to achieve with that?
So Digital Health.London is really about supporting the NHS to get digital.
Okay. Across the board, like wherever it can be.
Yeah, and we have a number of different programs. The first one was our accelerator program, which I set up about 5 years ago now. And that's about supporting startups and scale-ups with amazing innovations that can help the NHS. But then there's also, how do you support NHS staff with adopting digital solutions and finding those solutions? And it's, as I said before, I experienced kind of some of those challenges myself. And there is, it's not necessarily an easy thing to do, whether that's because of bandwidth or, how to find out about these solutions, or kind of how to navigate the decision-making processes, and how to do the implementation well. So there's that element of support that we give. And we've also done a lot in evidence generation related to digital health, because it's really important to evaluate the benefits and to know what good looks like when it comes to which SME you're going to work with. So those are some of the ways that we are supporting this drive to help the NHS to get digital. And I really feel that over the last 5 years, there's been, not just because of the last 9 months either, I've really seen a huge change even before this past year.
We can dig into that a little bit more, but I want to introduce Mridula, because Peppy, your company is currently on this year's cohort, or was it previously?
That's right. No, we're on the cohort this year.
With us, which is great. So before Peppy, I know you worked in consultancy and in pharma. So at what point did you know or believe that you wanted to make that leap into starting your own company?
Yeah, so I mean, mine is a sort of fairly standard South Asian immigrant story. My parents came here to work for the NHS, so I'd lived in
I didn't know that.
in hospital campuses both here and in India. So I was surrounded by this world of medics and hospital care, but decided I wasn't going to do that. Wasn't going to go to medical school. Went and became an engineer. Ended up doing my PhD in pharmaceutical manufacturing processes in the US at MIT, which is of course a hotbed of innovation, surrounded by, and some amazing world-class hospitals. So sort of biomedical innovation was sort of all around me then. And then I came back to London, as you say, sort of spent some time in consulting, but actually then spent all my time doing healthcare work there. So I spent about half of it working with the NHS, doing a lot of service redesign, trying to make regional health systems more financially, operationally, sustainable, and about half of the time working with pharma companies on a range of different things. And then
healthcare was kind of always a theme.
Healthcare has always been there either in the background or sort of tried to walk away from it, kept coming back. And then I was with Novartis Group for a number of years, where I ran one of their business units. But and we used to launch generic pharmaceuticals into the UK market. So making healthcare more accessible and affordable has been sort of a consistent thread for me. like Jenny, I have two young kids, and had experienced some of the challenges around that myself, and could start to see the digital health scene in London, really emerging. It was probably about 3 or 4 years ago. So, for me, it felt like the right time in my career and in my life to sort of move into the world of startups. So I joined another startup to begin with, met my co-founders and the three of us regrouped pretty shortly thereafter to found Peppy.
Okay. And so was it with Peppy, was the idea, so having spoken to quite a few people now on the show, whether they're leaders or whether they start their own companies, there's sort of two groups. It seems to be people that have a personal epiphany around it, and that might be because it's a direct personal experience or an indirect personal experience, or is more of an analytical, we've analyzed things, we've spotted an opportunity, and we've sort of targeted that specifically. So what, were you one of both or a bit of both?
A bit of both, but we're three co-founders. So I think, all of us came to Peppy from very different angles, which have all kind of enriched what we do. So for my co-founder, Max, it was very much that he'd just had his first child and was really in the sort of midst of, trying to figure out what's best for the health of his family. For Evan, it's a personal passion for lifestyle healthcare and preventative health, and the role of things like nutrition and exercise and other ways of managing your health well before you get to the point of being sort of ill enough that you need medical care. And for me, it was, sort of, as I said, sort of having spent this time in healthcare, recognizing that it's obviously a sector ripe for disruption. And one thing that was missing is really this view of patients as users rather than patients, especially in this sort of space where you're kind of not quite ill enough to meet a clinical threshold for care, but you'd need a lot of health support. Like, a lot of people's health journeys happen before they kind of show up at their GP's office.
Yeah, well, there's quite a few people in and around have tried to tackle that in different ways. So I'm super interested to hear you've done it, because there are people like, I don't know, on the more kind of let's digitize the NHS 111 website, like a Babylon type of approach, which is this giant decision tree, and you tootle away until eventually it ends up diagnosing you with something. But you've taken it in a different way.
Yeah, we focus on very specific life episodes where people's physical, mental, and emotional health, often goes through a change, and it's highly disruptive for themselves, for their family, and for their life at work. So we saw these three things really sort of coming together, and over a period of time. So, again, from personal experience, we knew that sort of having a baby will do that to you. And then as we sort of, whether it's advice on sleeping, feeding, recovery from birth, again, stuff that may not you may not even be aware that it needs medical care, or it may not need medical care, or your doctor's told you you'll be fine, it'll get better, and it might do, but there's lots of ways you can make yourself more comfortable or, help that process along. So that's really sort of what Peppy focuses on, is improving your quality of life, helping you find the right health support that you need, and being there to kind of guide you on the health journey. But, you're always the pilot. And I think this is, again, a fundamental shift in what we're doing.
And how, we spoke to Kate Newhouse a few weeks back, who is, she's the COO of something called Kooth, that are in the mental health space. And she said exactly the same thing around, it's the person, or it's the user that drives the experience. So how have you executed on that? So you feel free to pick a particular subject and maybe walk us through what a normal user might experience or see.
So the way Peppy works, Peppy's intended to be your companion through this journey. So let's take Peppy Baby as an example. So you might sign up for Peppy either through an employer or through one of the other public sector funded projects that we're doing when you are in your later stages of pregnancy. Our goal for that antenatal period is not to replicate anything your midwives are doing. They're still your sort of first point of clinical care, but we provide you with sort of education around things, whether it's sort of, breastfeeding, what to expect, preparing for coming home with your baby, which somehow everybody concentrates on the birth, but never about sort of what happens after that, all of those sorts of things. But it really kicks in after you come home from having delivered your baby, which is, and then you have access to a range of different ways to communicate with some of our practitioners. So we work with people like board certified lactation consultants, NCT practitioners,
and you can speak
counselors
directly to them if you want to, or is
yes.
it
So you have a chat channel that's opened up with your primary practitioner, and that will typically be a IBCLC or an NCT practitioner. So somebody who can address a lot of the broad spectrum questions that are relevant to, sort of those things with early days with a baby, answer any questions around sort of feeding, but then also signpost you into a lot of other activities that are available, lots of different ways in which you can interact with practitioners. So that could be a live session focusing on, pelvic health or, urinary incontinence, what's normal, your relationship after a baby, all these kinds of topics, how to spot signs of, problem signs around mental health, either in yourself or in your partner, which partners might be invited to. So topics like that. Or if you need to, you can also book a one-to-one phone or video consultation around feeding or sleep, which are often the hot topics.
Is it very much that someone can say, I have this concern today, and then it's not sort of, what am I trying to say? It's not really boxes. It's almost like free text, i.e. someone can say, I have this issue. Would someone mind talking to me about this, please? Exactly.
Okay. And your team of practitioners are there and they'll respond to you within the day. And you can do that, maybe you've got your toddler on one's hand, or you're taking, just drop them off to nursery on your way back, or, you've just managed to get your baby down for a nap without having to make the effort to go down to a drop-in clinic, which of course not all of them are running right now, and or to make a phone call during specific times and so on. It's available to you.
What other areas of life, you mentioned birth, pre and post birth, what other areas have you sort of focused on or seen a lot of pickup or sort of demand for?
Yeah, I mean, we've started off with women's health. We see ourselves as a family healthcare, but women's health is so underserved that it's sort of been an obvious area for us to start. So we've started off with birth and baby. We have a very active service in menopause. So we support women who are going through their menopausal journey, whether they're sort of perimenopausal or postmenopausal. And that's led by Kathy Abernethy, who's the former chair of the British Menopause Society. And then we have recently launched a fertility service, which is to support anyone who's trying to conceive, whether unassisted or making decisions around fertility treatment. And again, the concept is the same. It's sort of independent, safe space for you to get advice, information, education, again, so you can make the right choices for you and your family.
Jenny, would you agree that women's health has sort of been chronically underserved in certain ways? Because that's definitely a phrase that I've heard quite a bit over the last few weeks from different guests. Would you concur with that?
Yeah, I mean, I certainly think there's just a huge opportunity to make improvements in the space, and it is definitely a part of healthcare that's sort of ripe for innovation. That's why it's fantastic to have companies like Peppy on the DigitalHealth.London Accelerator at the moment. I think we also know that femtech as an industry, has got a huge business potential as well. There been lots of different reports that kind of indicate that say by 2027 it could be a $60 billion industry. So I think it's that combination of kind of need with business opportunity that's coming together and kind of really has made this particular area, has given it a lot of visibility, and I'm sure it will go on to grow over the years to come.
Yeah, I would totally agree. So with Peppy, if Peppy wasn't doing what you're doing, or for the people that aren't using Peppy for these areas of their life, what are their pathways like in comparison to if they were to have access to Peppy?
Yeah, so I mean, let's take menopause as an example. I mean, a lot of women, first of all, will often ask their mothers or their sisters or their friends in the first instance, because they don't necessarily see this as a medical issue, or, what was it like for you, or, how old are you, that sort of thing. Google. At some point they will go to their GP, but often we find people are sometimes embarrassed about talking about some of the aspects of menopause with their GP and feel like they don't have enough time to do that.
So that they're worried that they don't want to, quote, bother them, so to speak.
Yeah.
sort of.
And they're busy, you know, women in their 40s and 50s, which is the primary cohort of menopausal women, they're busy. They they working, they have maybe have young families to look after, they may have older family members that they're looking after, you know, that it takes a while for them to actually get for this to be urgent and important enough for them to have that appointment in the first instance. Then often, you know, I think there is still quite a sort of a mixed opinion out there about HRT, and whether, you know, who that's suitable for and who that's not. So they may be told that it's not right for them, or they don't know anything about it, or they've read things in the newspapers about breast cancer risk, and when the doctor mentions to it, they sort of freak out and go, oh, I don't really want to do that. If they're experiencing some of the mental health symptoms of menopause, they may be again offered antidepressants, which they might sort of say, oh, I don't know about that, I don't want to do it, or, you know, so and so they often find themselves bouncing around related to their how to manage their symptoms, sometimes without necessarily identifying it as menopause, and when they eventually do, then not really being clear on what to do with it, and not necessarily having the time to discuss the menopause in their entirety with their GP. And it really depends, you know, GPs have a very wide spectrum of caseload to deal with. They may not have that much expertise or knowledge about menopause specifically, or you might get lucky and have a GP who's particularly interested in women's health and has a deep interest in menopause, but it can be quite a postcode lottery.
I can well imagine. And so if they were to come to Peppy, how would that be different?
So again, you can sign up for Peppy. Menopause is primarily available through employers. So we work with a range of employers from Santander, Novartis, Aviva, and so on. And so they can get. Sorry,
does that mean presumably it's free to the person? It's free.
Yes, that's always how Peppy has operated so far. It's free to the point of use. It's free and it's anonymous to your employer if that's how you're getting it, which is a really important part of how we operate. So again, you can download the app and you'll be put onto, again, you have chat access to a menopause practitioner, and we'll drip feed you content and information relevant to different aspects of menopause. So you can learn about you know, whether that's nutrition during the menopause, HRT, you know, myth busting, or whatever that might be. Again, you have access to a counselor if you want to discuss your mental well-being, and again, similar sort of sessions where you know, if you have a partner, that they can be invited to learn about as well, because it can often be very disruptive for other members of the family too.
Yeah, and confusing, presumably.
Very confusing. Yeah.
Okay, that sounds quite sort of like a major step forward, by the sounds of it.
Yeah, I mean, some of the stories we hear have been incredible. People really feeling like their lives have changed. We had one particular lady from one of our employers who said, you know, her 16-year-old daughter said, look, I've got my mum back.
Wow.
It has been
amazing,
which is incredible, because
that's a great story.
Yeah, and this wasn't necessarily somebody who would, you know, require, you know, psychiatric care or any kind of like medicalized care in that sense.
So it's sort of like below the level of anything diagnosable or treatable through a traditional clinical pathway, but that level actually could still include quite a lot of issues or problems or difficult symptoms.
Yeah, although I do think it's important to mention that one of the things that principles of Peppy is that we want to work alongside existing medical systems, whether that's the NHS, whether that's a private medical insurance that you've got access to through your employer. Peppy is designed to be able to triage you into that. So if at any point...
So let's talk about that, because that came up when we talked to Kate from Kooth about at what point do you then have to triage people up through the system?
Yeah, it's very, very important. And this is why we only work with sort of qualified, healthcare professionals. You know, they're not sort of generalist coaches. They are trained to recognize what are sort of the warning signs of something more, fundamental that could be underlying. And we signpost people, whether that's back to their GP, whether for baby, whether it's their midwifery or health visiting team, or an IAPT service, helping them find their local self-referral IAPT service, or if they do have access to private medical insurance, knowing what services are available, or an employee assistance program.
That risk. What was really interesting was that where Kate was basically saying that within their view, which is mental health, so it's different to what it's like. Well, I mean, yours contains an element of mental health, so it's all sort of within the same space to an extent. But their main view, which I don't know whether you agree with, is that by offering a service digitally, you increase access to that service, but you don't increase risk because the risk is there anyway. So actually, by offering the service, you actually reduce the chance of poor outcomes. But a misperception of digital delivery of services is that it increases risk.
Yeah, I think I agree with that. And we actually did. So we were one of the awardees of TechForce 19, which is a cross-departmental initiative to support vulnerable populations in the community. And we actually asked, so we rolled out the Peppy Baby service to 1,000 new parents across England in May of last year. And we asked them, how did Peppy impact their health-seeking behaviors, essentially? So we asked them, did Peppy help nudge you to seek support from statutory services either sooner than you would have because you maybe weren't sure where to go for help, or you might have been reluctant? And the answer was yes. And across a range of services. And we also asked the question, did Peppy help you avoid some of those episodes because you're able to get the information that you needed? And the answer was also yes. So we see our role as being, sort of I think we see real potential to be risk stratifying. Yeah. But again, people often in the episodes that we work with don't seek help either because, as you say, they don't want to bother their GP. They don't know whether to go, or they don't know if it's sort of all in their head sometimes as well, which is something that comes up quite a lot.
Well, one of the things that we came across one of the reasons why we started PocDoc, which was to allow people to give themselves blood tests at home to screen for things that can be screened for using a finger prick of blood. You don't have to have a venous blood sample. You don't have to go to the doctors. It just happens to be that is the clinical pathway currently. And the reason why we started that was because there were a huge number of people that said, on the one hand, well, I'd love to have more information about my health, but the idea of me taking a half day off to go to the GP to do something that is not critically urgent now, but could be critically urgent in the future if you don't do something about it, it's just not really practical. So that's why we sort of tried to deliver our services, is to sort of exactly provide that type of thing for people that want some information or want to do something about it, but their life circumstances may just, for no bad reason, just prevent them from doing so.
Yeah, and as you said, like, that doesn't change that person's underlying level of risk.
The risk is there. If anything, it reduces it.
Exactly.
Because they have an easier pathway to transition. So in that study, I saw that you actually had, you were able within that TechForce 19, didn't you have an over-index of Black and minority ethnic women in that study?
Yeah, that's exactly right. So we actually, we had a flood of applications. We had 10,000 people apply for 1,000 slots for that piece of work. So we did over-index. We took double the national average of Black new parents, Asian, and any other minority ethnic parents. And we saw something really interesting, and that's what's led to the Black Mums Matter Too campaign. Because we have in the UK a big problem with racial inequalities in maternal health. So Black mothers have 5 times the rate of maternal mortality of white mothers, and Asian mothers have twice the rate, which is, it's lots of factors that go into that, but that is fundamentally an unacceptable inequality, and of something that has happened, this is pre-COVID. Now, on top of that, you take the fact that Black and Asian and other ethnic minorities do have higher risk of COVID morbidity, or more severe, some have a predilection for more severe COVID symptoms. And what we found with our first wave of TechForce, and this was before some of this data had come out, was that actually when we worked with those parents, they engaged with Peppy just as much as the white majority of users did. Some slightly different patterns of behavior, but that's definitely got interest from a lot of the maternity units or people who are working in maternity services, because historically these engagement with services has been an issue, has been one of the contributing factors. Secondly, we found that they rated Peppy higher than average. And obviously we don't know we haven't fully unraveled what some of the underlying reasons for that are, but there is work sort of being scoped out now to start to do that. But basically we think that, that digital has a potential to allow this ease of access in a way that is, sort of maybe more neutral, might feel more anonymous, although obviously we have to have appropriate safeguarding measures in there and safety measures in there. But that just enables people to access health in a different way that might be more, makes it more democratic and makes it more accessible to more groups of people.
Yes, I would agree. And I know that health equality and equal access is important for both of you. And so I just want to go back to, so I read one of the reasons, so I know Mridula, you weren't actually scheduled to come on the show, but the story was that your PR department, who are fantastic, sent me the press release, or sent us the press release for Black Mums Matter 2 last week. And I read it, and I'm going to repeat two of the statistics that were just completely sobering to me. So I thought we've got to try and find a way to get you on the show. And one is, as you mentioned, that Black women are 4 or 5 times more likely to die during pregnancy, childbirth, or post-birth than white women. And the second is that Black women are twice as likely to experience a stillbirth than white women, which, I mean, I thought was just unbelievably sobering that is the case in this day and age. And I wanted to understand, first of all, what do you think, or what do we know, are the reasons for that disparity, first of all?
Well, I think it's quite complex, and I don't think anybody really knows fully what it is. I mean, obviously we've seen data that has sort of extracted out impact of socioeconomic circumstances. The inequality still persists. We know that there are differences in health-seeking behaviors, sometimes because of sort of people's cultural backgrounds on antenatal care, which accounts for some of it, but not all of it. There is a sort of a perception of how people are treated or expect to be treated that can affect that health-seeking behavior. There's a whole host of things in there.
What does expect to be treated mean? What does that mean?
The question is whether, if you expect to be heard and take your problems taken seriously and responded to, your health-seeking behavior is different when in choosing to either go to sort of your health visitor drop-in clinic or pick up the phone. Then if you either expect, based on your personal experience or through other people's secondhand experience, that actually they're not going to listen to me.
Right. So why call in the first place?
Why call in the first place? So there's a whole host of things. It's not a simple issue to address, we're not claiming that Peppy can address all of it. What we know is that our Black parents from Tech Force One liked the service. They found it very useful. And right now we're in a situation where this is a cohort who are going to be facing quite some considerable challenges on top of some underlying challenges that they face. So we want to basically go out there and make it available to them. And the National Lottery Community Fund, through their COVID response fund, has enabled us to do that through some funding they've provided. So we are going to be making Peppy Baby available to 200 mums who either identify as Black or of African descent. And again, free for them to just help them during what's been quite a difficult winter.
Okay. And is there anything, what happens, because I imagine that it will be oversubscribed and it will deliver an extremely successful outcomes and so on. So what are you doing this because you have a sort of a greater vision after this, or so what does that kind of look like?
Well, so what they will get is Peppy support as any of our other Peppy members for 3 months, and we'll be catering, we are working with some of our advisors and so on to make sure that the content that they get will cater to their needs specifically. Why are we doing this? Well, we've set off, partly the issue with Peppy is, as I said, the average experience, as I mentioned, is people sort of bouncing around, maybe getting help from friends and family, anecdotal Googling, etc. It doesn't matter whether it's menopause, baby, or there is one end of that spectrum, which is, you go to Harley Street and you pay out of pocket and you have them, your maternity nurse or private lactation come to your house. That's not available for them. That's not affordable or available for the majority of people. Partly we realize with Peppy, there is a premium service out there, but it's only available to a tiny slither of society. We wanted to enable a solution that made it much more accessible to the vast majority of society.
Presumably, because did you always have the intention that it would be free, which took you off to the pathway of working with employers, insurers, and healthcare services? Because if it has to be, someone has to pay for it in some way, shape, or form. So that then dictates slightly how you deliver that service or who you ultimately partner with.
Exactly. And for us, COVID has unlocked other streams of funding whereby we can make the service accessible to people who may or may not be able to access it through our employer clients. So that has been great. So we want to design this, the service to be as accessible and relevant to as broad a spectrum of society as possible. We actually have also set up a community interest company that allows us to run these projects on a not-for-profit basis. So that's how Black Mums Matter too is going to be, is being run. And we're working with some great people who are backing the project. So Mars Lord, who is a campaigner in this space, and also Abdullah. The 5 Times More team, Eddie Morris, who is the chair of the Royal College of Obs and Gynae, and Dr. Karen Joash as well.
Jenny, I want to bring you in here as well, because I know that DigitalHealth.London are a big supporter of this campaign. And how common or how usual is this type of thing, an example of why it matters to get companies like Peppy onto the Digital Health Accelerator? Why is this an example of what you do and why what you do is valuable?
Yeah, absolutely. We're hugely supportive of the campaign. I mean, I think the stats are absolutely shocking. And it's interesting, actually, when you look outside the UK, say to the US, if we take New York City, I think the stats are even worse. The kind of mortality rate of Black mums can be up to 12 times as high. So yes, and it makes us feel extremely proud to be able to support a company that's doing such great work. I guess I would also say that we support a huge range of different companies that address all sorts of different health conditions. We actually on this current cohort have a company that addresses men's health too.
Yep. Yeah, Max from Regimen, he's coming on next week.
Oh, is he? Amazing.
Yeah, we're going to talk about erectile dysfunction next week.
Indeed. Yeah. But it's important. I think there are there's a real need, isn't there, to kind of raise awareness.
And just talk about these issues.
Yeah, kind of address the taboos. But it's hugely broad, and I think that the access piece is key. And digital health, it switches up the geographies of health, and in many ways it presents huge opportunities like this does. And we know at the same time it can also produce more inequality. So
yes.
It's being really mindful of the way that digital health is changing the health landscape, and we'll go on to. And it's about kind of really supporting where there's positive opportunity and really recognizing actually some of the risks as well.
Yeah, so I think you may have seen a copy of my notes, because that was like my
really?
next question. Yeah, that was my next question, which is, I don't know if you've seen in the news today over the last couple of days, there's been a big, what with all of the children, everyone's kids being homeschooled, the widening inequality between children that have access to technology that means they can have their lessons versus children that don't. And the government's obviously trying to fill the gap and things like that, but it relates to a point that you've just mentioned. And this was something that got thrown at us, over the time that we've been doing the company. I don't know if it's the same for you, Mridula, but certainly, Jenny, where it's that people are concerned that by delivering a digital service, it will only be accessed or will be more sort of, it will swing towards people who have digital devices, which therefore self-selects for people that have enough money to have those digital devices, who are more educated about accessing digital services and so on. So it entrenches that inequality. What do you think, Jenny? Because obviously I think you're in a really good position to comment on that. I'm playing devil's advocate, because obviously
I think the good thing though is that there is real awareness, and so when it comes to the NHS, working say with digital health companies like yourselves, is I would say that there is a real kind of thought that goes into that.
Yes.
Clinicians do recognise the challenges when you introduce something new. It's not necessarily all positive. You have to kind of think ahead, don't you?
Yeah.
And think, well, what mitigation can you put in place?
Yeah.
Or actually, if you bring in this kind of benefit, does it mean you can support other patients more or in different ways? I think the key is, it would be wrong not to move forward and not to embrace these things, but you just have to do it really thoughtfully.
Yeah.
And and that's why I get quite excited when I find out about different ways that, regions or governments have thought about kind of how do they address this, whether that's about making data available or devices and kind of piloting different things such that, that those issues are reduced. It might be training for people who actually have a long-term condition, actually would really benefit from having certain tech, but they need that support up front. But once you've given that support, then actually, they can go on and manage their own healthcare better and feel empowered. But you've just got to think and not, I guess, assume.
Yeah, you've got to think it through, think the pathway through to ensure you kind of rule out as many of those unintended consequences as possible, but not stand in the way of progress. Mridula, what's your view from Peppy's perspective about that issue?
I mean, the digital divide it's not just a health issue, right? It's the same in terms of access to financial services. It's, getting increasingly more expensive to walk into a shop and buy something with cash than it is to buy it online. I think it's a very fair challenge, because it's not just access to a digital device. It's, how much people can afford to spend on data, which is becoming an issue now for homeschooling. And it can be something as fundamental as literacy, but also tech can. So I agree, it's absolutely about, and we're actually just working on scoping out a project to say, how can we sort of mitigate from our product design perspective as many of those aspects as possible. But tech also enables you to overcome some of those barriers, whether that's auto translation, whether it's doing things in audio and video rather than text-based pamphlets with multiple translations. So it's pros and cons. I think we have to do it with an eye on recognizing the limitations and not be blind to that. But ultimately, I think there's a net benefit. So, from my point of view, as you, Steve, a health tech entrepreneur, I see it as a sort of duty to kind of drive that forward to the best of the ability. And
I think we would think the same thing. And it's more around how do you do that in a responsible way? Because the aim, and I'm sure it's the same for all of us, is that we'd like to deliver the highest quality of care to the greatest number of people. So it's certainly no one's looking to try and exclude anyone. So it's about how do you try and address those issues to avoid a situation where someone is unintentionally unable to access that service by some quirk of a postcode or some quirk of an economic situation, as opposed to a personal choice to not want to access that.
Exactly.
Okay, so with Peppy, where are you going to go from here, do you think? Is it more areas of health, or is it, like, let's say, for example, to your point a second ago, is it adding more language capability so that you can address more communities for the same conditions, or how do you see it evolving?
Yeah, I mean, I think there is still a lot of, obviously we've only just got started. We're 2 years old as an organization. There's a lot of space to still expand within what we're working on, which is baby fertility and menopause, both within our employer space and with other, whether that's insurers and other ways of supporting the system. There's a lot of work to continue to do on our product. As I said, we're sort of doing some of the scoping out of projects to develop that. But the more we talk to people, the more we hear of other sort of life stages where they have felt either a bit lost or struggled to manage their health or that of a family member. So that is something we're actively always exploring and keeping our eyes and ears open for as well.
And with regards to the Black Mums Matter Too campaign, is there anything that you want people to do, or what can people do to become involved or to support or to apply, or how does that work?
Please spread the word. There is a link, Steve, if we could share that with you to go on the website. That would be amazing, where you can sign up. There are just a couple of weeks for the sign up. I know we've had several coming through already. We only started the campaign yesterday. So if that's you, if you are in your last trimester of pregnancy or have a baby that's less than 3 months old, and you either identify as Black or of African descent, we're here for you, so do sign up. Otherwise, please spread the word amongst your communities or your friends and family as to around this issue. We want this to be, this is partly, we're here to support those mums who are being affected today, but also to raise awareness of this issue as well.
With the content that's provided, do you adjust the content or the actual engagement based on the ethnic background of the person that's engaging with Peppy, or how do you deal with that?
Well, I think, yeah, I mean, we want to make sure that the content is relevant, and here we'll have a cohort of people for whom we can put on, whether it's a particular speaker or, and that's something that we also actively seek input from our users from. But, Black mums is a pretty broad spectrum of people from, who they could obviously lots of different countries, lots of different languages, lots of different religious backgrounds included within that. So, we do not presume to know anything beyond what you choose to tell us. But yes, we will be, actively looking at having maybe some presenters who are themselves have been gone through the experience of motherhood as Black women, Mars, and Mars, for example. Yeah.
Okay, so Jenny, with the Digital Health London Accelerator, what is the DigitalHealth.London? What does is it continuing to do more of the same because of what you're doing is already delivering so much value, or do you have any kind of major projects that you personally want to kind of launch, anything new? What does the future sort of hold?
Well, I think it's a really exciting time. I've certainly felt kind of over the last few months, I've had a lot of kind of old colleagues get in touch and say, wow, this health tech space, it's so
oh, that's what you do. Oh, cool.
Yeah, no, I understand. Oh, wow, you were thinking ahead there, weren't you?
Digital health, yes.
So I think it's an exciting time. I think that we're very kind of passionate about the two big programs. We run the Accelerator and the Pioneer Fellowship, but I guess it's really about kind of making that next step, which is how do we help the NHS to get digital, really focusing on supporting those NHS kind of staff members that perhaps have really experienced the benefits over the last 9 months and actually want to take things.
Get the converts, basically.
Yeah.
Is that what you
mean? Well, I mean, that's always what we've done. It's kind of, how do you find the champions? How do you find those pioneers, those early adopters? And how do you nurture them? And how do you support them and be really responsive? Because they're the ones, that are brave, that want to make the change and want to engage with amazing companies like yourself. And I think it's about the fact there's going to be more of those people. But it's, a lot of the changes that have been made have been fantastic, but we had to be made really quickly and maybe not as deeply. So if you think about kind of pathway transformation, you might be replacing something that was physical with, a video consultation, for example, but not really deeply looking at a pathway. You could take the maternity pathway,
okay,
for example, and actually thinking, well, could we design this differently or better, knowing that we now have all these different digital tools? If you think about your business, Steve, if you've got those things there, then actually do you need certain appointments?
Yeah.
Can you empower patients more? So I think that's the next bit that's really exciting, is that kind of real deep kind of fundamental change, and we want to support that through those two programs, but also do more in evidence generation. As I said earlier, we're involved.
Yeah, you talked about that. Explain a bit about what you mean, because I'm not sure all the listeners are necessarily going to immediately understand exactly why that's so important and your role in it.
Yeah, so I think that it's really important because there are, there's a lot of solutions out there, and when it comes to making a decision about what solution you're going to adopt, you want to know that a digital health business meets certain standards, and those standards need to be there. And we worked with NICE, MedCity and other colleagues back in 2018 to formulate those standards. And we now help companies like yourselves in the Accelerator to meet those. So the kind of how do you do it? But then there's also the piece about kind of, well, do staff within the NHS know about standards? and how do we help with that kind of education and awareness,
Right.
such that they're asking the right questions. Maybe they can make
Okay.
decisions about which innovations they work with, which ones they don't.
So, no, go on, sorry.
Informing the adoption and kind of speeding things up.
And is part of that, like, sort of like you said, trying to get everybody on the same page about the metrics of success, that you know, so that if company A does something and it performs in this way, generally speaking, we can all be assured that we understand that that was a success or it was not a success within the system, so it's easy to kind of compare like for like. Is it partly that, or is that not really the case?
I think in terms of the evidence standards that have been released so far, there's an element, I'm guessing you're getting at the kind of economic part to it, but I think there's even more to do there on the benefits realization piece, both in terms of kind of how you do that well and ensure it takes place.
Yeah.
But actually, when, you know, sometimes we see that startups may engage with NHS and be so kind of excited to do something that they perhaps don't think up front what those metrics should be, and really kind of push for that discussion and get that baseline data, so that when the pilot's done, or they've been working with that organisation for a year or so, they can then go and work somewhere else because they've got this great evidence of how much money it saves, of how patient care has been improved. And that's what I think really key to scaling, because you can, you know, scale through, you know, a lot of shoe level, but actually what really matters is the evidence, and I think that's an important area for us to continue to support on.
Well, I think that's a good point to kind of wrap it up on. So both of you, thank you very much for your time. It was great having you both on the show. First time to have two people, so thank you very much for that. And I thought it was an incredible discussion. You know, and yeah, so just thank you very much for taking part.
Thank you.
Yeah, thanks for inviting us, Steve.
No worries. Have a great day.
Take care.
Bye.
Bye.